as the second wave spreads across the country into rural India and small towns, India faces an unprecedented challenge, one that requires the Indian state to mobilize all its resources to be able to respond better and more effectively than it has done so far. The response requires two very crucial things to move simultaneously. One, the Indian health system needs to be far better prepared than it has been thus far to be able to respond to the challenge of the second wave as it travels through. And second, we need to be able to streamline and strengthen our vaccination policy. Underlying both these issues is the crucial question of governance. What are the kinds of governance mechanisms that need to be put in place in order that both the health system is able to ready itself and respond, and our vaccination policy is able to ensure that all those who need to be vaccinated get vaccinated fast in order to ensure that the worst of the pandemic doesn't hit our population. I have together here with me two of CPR's foremost researchers who've been looking not just at India's health system over many decades, but also been very closely tracking the pandemic as it unfolded from March last year, working closely not just on the research side, but also with state governments to prepare and strengthen the pandemic response. Jishnu, let me start with you by asking you to talk to us a little bit about what we need to do in terms of preparing our health system to respond as the pandemic now travels out of the metropolitan cities and the large cities into small towns and rural India.
Thanks, Yamini. So a couple of things here. I mean, I think that the epidemic seems to be spreading out from the original urban corridors, starting from Maharashtra to now different areas of the country and to rural districts. And my guess is twofold. I mean, the first is we need to know what's happening, right? And that's been really hard to get at, partly because we don't know the extent of testing in rural areas. So we really don't have a national or even state level frameworks of being able to detect positivity and number of cases in a way that's systematic across the country. Right. So we're still stuck with, is District A, does it have a lower caseload just because there isn't enough testing or because antigen tests are used more than RT-PCRs? And the fact of the matter is the fact that we don't have a centralized testing policy that is giving us consistent data series across all districts in India remains a problem. Right. I think different districts have taken on kind of different innovative approaches with, setting up war control rooms, setting up very highly sophisticated data centers, but this doesn't seem to be a universal story, right? So I think eventually by the time that we pick up that a district is in trouble, especially if it's in a rural area, things need to move on a fairly urgent basis. And, I want to quote something here from an article that Nachiket Moore, who, as you know, has worked on health for a long time in India, wrote recently in an article. He says, look, and I'm quoting now, as far back as February 2020, doctors in Lombardy, Italy, one of the best equipped hospital systems in the world, cried on camera, wrote in the venerable New England Journal of Medicine, begging the world to learn from their experience that hospitals are not the answer, but their advice fell on deaf ears, right? So he has 2-3 very interesting suggestions where he says, look, we need to recognize that exclusive hospital-based responses, while necessary from a humanitarian perspective, will ultimately be overwhelmed no matter how strong they are, right? Interestingly, he says, look, and this will come as obviously somewhat, not correct given the current environment. But he says, look, the supply of oxygen and availability of ventilators, which are right now the bottleneck, will be alleviated. But the line he says is the rate limiting step. The rate limiting step is increasing the availability of trained pulmonologists, intensivists, and anesthetists, which we can't do in the year or two that we will really need them. And what his point was, look, given that there are only a couple of drugs that seem to be working well in clinical trials, uh, and the fact that low flow oxygen is fairly easy to administer, even with, and he says 15 minutes training, there is a potential of, in rural areas, setting up local field hospitals that start catering to patients closer to where they are, rather than bringing them all the way to urban hospitals, which is what's been happening so far.
Okay.
Just to conclude, two things. We need a better way of training up providers, and we need to decrease our reliance on urban hospitals and think about what we can do to set up rapid field hospitals in rural districts, given that we will have a shortage of person power in terms of medical personnel in hospitals moving forward.
Jishnu, can you also talk a little bit about how we can better deploy the existing infrastructure? So we do have at least physical buildings spread all over the country. We spent the last 15 to 20 years with the National Health Mission building primary health centers, wellness centers, putting in place ASHA workers. The Anganwadi system is functional, ANMs are available. Are there ways, I know various states are trying to better deploy this army of workers and this sort of infrastructure as it exists today, but are there lessons from other states? Are there ways in which we can do this better? Just some of your thoughts on that, especially based on your work in West Bengal and other states in the country. Give us a sense of what preparedness is happening and what more we can do.
So, for somebody who's looking at this from the safety of being outside, what has been very puzzling for me is, look, we know how to manage disasters, right? I mean, whether you think of the Bhuj earthquake or the Orissa floods, in each of these cases, we knew how to set up the logistic chain, and we knew how to get things done, right? So at some level, it has, if you look at what kind of Devesh Kapoor, who's a pretty top political scientist, says, he says the puzzle with the Indian state has always been that it's highly functional in emergencies, right? And what happened here was exactly the opposite, which is we collapsed in an emergency, at least at the central level, right? And different states have obviously responded in different ways. So I actually think, although usually my work suggests that centralization is not a great, has not worked very well in a lot of Indian states or in the Indian scenario, here's one occasion where we need a strong centralized response, at least at the state level, right? And let me give you a couple of reasons why. One is, if you look across districts, the covariance, by which we mean if district A is affected in the state, how likely is it that district F is also surging at the same time? That covariance turns out to be not that high, which means even within a state, sometimes you have one district surging and another not, right? So you need to be able to move resources fairly quickly from one place to another, depending upon where things are going badly, or you need to move patients from one place to another, depending on how things are, or on whether things are going badly, right? I don't know whether you've ever, been stuck in accidents or in bad situations. I have, and believe me, even trying to get a transport out of a village into town when you have somebody who's in really bad shape, the drivers will just say, "Ye to mere gaadi mein mar jayega, isko nahi le jane wala," right? So I can imagine that in villages, even just transporting people right now is really hard, right? And my guess is a centralized response that says, let's take a data-driven approach to which are the districts that need help right now, right? How do we centralize triage and referral, and how do we provide care close to where these villages are, have to be the elements of a tailored response moving forward in dealing with this crisis.
Thank you. So, Partha, Jishnu has spoken about what we need to do to respond to the crisis in its immediacy as it travels through the country, and the ravages of COVID are felt across rural India. But there is this other element of the puzzle, which is our vaccine policy. If we go back to January of this year, as India began to unfold its vaccination policy and also began to promise the world vaccines, it did look as though we were now at the end game because we had the ability to vaccinate our population and do so at speed. Yet we are in this situation where there seems to be not just a lot of policy confusion about vaccinations. There also seem to be very, very crucial issues around both the supply of vaccines, who we should be vaccinating, and questions around the governance of the vaccination policy itself, what the center should do and what states should do. You've been following both the trajectory of our vaccinations as they began in January, but also the dynamics of the policies as they have unfolded, changed, evolved, unraveled. Can you talk to us a little bit about how we've got here, but also tell us a little bit about what we need to do to move forward?
So, Yamini, how we got here is a long story, and I don't think it's useful at this time because it's sordid, it has many mistakes that have been made along the way. But fundamentally, what we now have is a situation where, as Jishnu was saying, we do need a certain level of centralization. But that centralization needs to be done in a manner where people sort of agree to cede power. What has happened as part of the vaccine story is that the center has exercised power but has not taken the states into confidence. And as a result of which, you have a situation where states have been making demands about who to vaccinate, as you say. So while we still have about 200 million people above the age of 45 who constitute about 8 to 9 out of every 10 deaths in this country from COVID, while 200 million people above that age still remain to be vaccinated, the states have been asking for the right to vaccinate the younger people from 18 to 40. And some of them, of course, a number of them with comorbidity structures do need vaccination. And it is in this tussle that we now have come to a situation where India is the only country in the world, only federal country in the world which has allowed subnational entities to procure vaccines on their own. Every other country in the world, the national government is procuring vaccines and distributing them to both private and subnational governments. So, as a result of which, we now have a situation where, for reasons I said I'd rather not talk about now, we have two vaccine makers who have currently a capacity of about 75 million doses a month. And you have suddenly this 800 million strong group who are demanding to be vaccinated. And states are now making tall claims about we shall procure, make global tenders, structures, etc. None of which is actually quite feasible in a situation where there's a global shortage of vaccines. So currently what we have is a situation that's essentially untenable. It comes from bad decisions being made by both the state and the center. And the sooner we try and walk back from this precipice and go back to a more rational vaccination policy, the better it will be. The second thing is, what can that particular type of a vaccination policy involve? Yes, we definitely need to focus much more on the older people, because while there has been a lot of discussion about younger people getting affected and so on during this pandemic, whatever scraps of data, and this is a big problem right now, because this, Jishnu was saying positivity in districts. Today, the ICMR Director General just said that 530 plus districts in this country have more than 10% positivity. But it's only he who knows that number, because only the ICMR has the data and it's completely centralized, which allows this particular analysis to be made. Similarly, what are vaccine breakthroughs? Again, they have that kind of data. It's in how many people with vaccinations are getting admitted into hospitals. Maybe we are counting, maybe we are not. So, a number of these issues. So, is vaccination? All of this goes into the other part of Vishnu's story, and the question that you're asking is: can vaccinations help slow down the epidemic or act as a mitigant to severe infections? So, I vaccinate somebody today. Roughly 3 weeks from now, he's supposed to have a certain level of protection. It varies from what numbers people talk about, depending on under what conditions the studies have been made. But let's say he has about 60% protection. That's still much better than having no protection at all. Mm. And that would help both the person have a milder disease, hopefully, if he's infected or she is infected, and slow down the progress of the disease going forward. So where do we start? So the first thing is we need to start among the older age. Second, do we start in the areas where there is a lot of cases already happening? Nearby, predicting where the cases would happen. There is a certain level of movement. If you study, let's say, districts that are moving from, let's say, in the top 75% of cases, they move into the top 50% of the cases as the pandemic spreads out. So you can, with at least a couple of weeks, figure out where the pandemic is going to be, because it starts emerging it gives you about, let's say, a couple of weeks of window room into when this stuff is happening, right? So we could actually start doing vaccination policy that is sort of running ahead of the curve, as it were, if it was possible. Right? But all of that requires states to agree that yes, a certain portion of the vaccines will be used for this purpose. So if Odisha is currently having a relatively quiet time and Chhattisgarh is experiencing a surge, it's okay to give Chhattisgarh more vaccines than it is required at this time, because they need it more, and my time might come, and therefore then I will get more vaccines at that point in time. Right? This level of discussion, conviviality, and coordination is not something that we have seen as part of the pandemic. We are not seeing it, as Jishnu said, in mobility of resources, and we are not seeing it now in the allocation of things like vaccines. Now, this is unusual because this is a country where we have had the center allocate resources to states under a variety of schemes, starting from taxes to central sector schemes to a variety of other programs. We have redesigned central sector programs like the National Health Mission to have flexible tools. So these are all lessons that we know ourselves, and yet we have chosen not to use them, not to apply them in the current crisis that we are facing today. So this is the hurdle that we must cross. This is a mental barrier amongst the political leadership that we must overcome if we are to have a fighting chance of essentially minimizing the impact of this pandemic.
Thank you, Jishnu, and thank you, Partho. I think what both Jishnu and Partho have said highlight one of the most fundamental issues that have severely undermined the Indian state's capability to respond effectively to the pandemic. As Jishnu rightly said, the Indian state, for all its incompetence over many, many decades, particularly when it comes to providing quality healthcare, education, basic services to citizens, has at least been able to excel when it comes to what the economist Lan Pritchett calls thin logistical tasks, where goals are clear, where command and control mechanisms can be deployed, and where actions can be monitored from afar. And that's one of the reasons why the Indian state has more or less been competent when it comes to disaster management. We proudly also say that we can conduct large-scale events like elections, and somewhat ironically, we've been relatively successful at conducting large-scale one-off events like vaccinations and immunization programs in the past as well. Yet all of this has fallen apart when it comes to a pandemic response. And in my understanding, one of the reasons why that is the case is because a pandemic response has completely undermined one of the most basic principles of governance, the principle of subsidiarity. That which should be, those functions should be performed by those levels of government which are most capable of performing them. And that which should be performed at the central authority should only be performed at the central authority and no other, i.e. the central government should not be doing that which state governments are better capable of doing. The state governments should not be doing that which local governments are capable of doing. Even in times that are not pandemic times, the Indian state has failed to effectively craft out this allocation of roles and responsibilities based on the principles of subsidiarity. There is a large amount of overlapping, of overstepping, of encroachment, the center doing what the state governments should be doing, the state governments doing what local governments should be doing. And all of this together in the context of the pandemic has actually come back to be the fundamental cause of all the issues that both Jishnu and Partha have spoken about just now. We began the pandemic back in 2020 with over-centralization. The central government invoked the National Disaster Management Act to essentially do many things that state governments should have done and forgot the one thing that the central government ought to have done even at the time when the country was first only beginning to deal with lockdown logistics and management, which was the need for interstate coordination. When we were dealing with the lockdown and we saw very visibly the fact that India actually has a national labor market, a national goods and services network, which requires states to coordinate with each other. And when state borders close down, people need to move, goods need to move, somebody needs to coordinate that. I recall back in April, Punjab had to slow down its procurement in the midst of its harvest season because jute mills in West Bengal were closed and were not treated as essential services in the lockdown back then. There was no institutional mechanism for the Chief Minister of Punjab to negotiate with the Chief Minister of West Bengal. Instead, the Chief Minister of Punjab had to issue letters through Twitter and other means to try and resolve this very basic coordination that needed to be done between states. We are seeing this now in how we are responding to different aspects of the pandemic. Jishnu spoke about it in the context of health services and movement of health resources across locations, both between states and within states. Partha has talked about it in the context of the need to think about allocation of resources and allocation of vaccines. All of this requires political maturity, trust between levels of government and an institutional mechanism to enable this. We had, in fact, back in April or May of 2020, at the Center for Policy Research, put out a report that suggested the need for setting up an interstate council under the structure of the National Disaster Management Act that could, along with high-level political negotiation, Prime Minister, Chief Ministers, Cabinet Ministers, and relevant state ministers, as well have a executive secretariat of bureaucrats to interact and engage with one another to resolve precisely these issues and, more crucially, build trust. We lost that opportunity. And I think the absence of that institutionalized mechanism is one of the most crucial reasons why the kinds of negotiations we need to do, the kinds of logistical supply chain negotiations that we need to do, which Jishnu spoke about, the difficult allocation-related negotiations that Partha spoke about, need to be done. But without that, there is no space, there is no trust. and it is to chief ministers to battle it out on Twitter and battle it out with the Prime Minister, leaving citizens wondering where they will be able to access resources that they need most in times of a pandemic. If we don't solve this, our ability to be responsive, agile, and capable of responding to the challenge that the Indian state confronts is going to be significantly limited. So from the governance perspective, the one big thing I think that we need to do is to set up this interstate coordination structure, whichever way and form it may develop, is not the issue now as much as setting up of that structure to be able to resolve these issues.